Welcome, everyone. For those I haven't met, my name is Jennifer Hoskevec, and I'm the Vice President of Medical Affairs here at BillionToOne. We are so excited to have you here tonight for what we hope will be a really memorable evening for us all. A word about where you are. This building, the Franklin School, has been standing in the heart of Washington, D.C. since 1869. It was a national historic landmark long before it became the word museum, a space that is dedicated to the power and history of language. Interesting fact, where you entered today is where Alexander Graham Bell sent the first wireless transmission of the human voice in 1880. We believe this historic place, which was built on the power of words and voice, is the perfect home for an announcement about a breakthrough that has been a long time coming. Before we get going tonight, I would like to introduce the BillionToOne team. People around the room from our organization, please raise your hand. Great. These people will be around through the evening to answer any questions you have after the presentation. We have folks from the product team, we have folks from the commercial sales team, we have executives, and we have folks from the medical team. We are all identified by the little pin that we're wearing, so please come talk to us after the presentation. That's what we're here for. We want to hear what you have to say. I have attended many ACOGs in my career, but this one truly stands out because of what we have to share today. And I can't wait for you to hear, but it's not going to be me who tells you what we have in store. So for that, I will hand it over to our co-founder and CEO.
Please welcome to the stage, Osan Ate.
Thank you, everyone. Thank you for being here. Thank you for listening to us. It was almost exactly a decade ago when David and I, my co-founder, asked the question, a single challenging question, which was, what is one problem that physics allows us to solve that if we didn't solve would remain as an unsolved problem? We purposefully tried to focus on a problem that was really big, global, and we were actually trying to solve the problem that World Health Organization has recognized as one of the most important global healthcare problems, not just in prenatal testing, actually, across every single field. That is sickle cell disease and beta thalassemias. They are the most common genetic disorders in the world, and they are recognized as a really critical global healthcare burden. That question took us to the hardest problems in prenatal screening. These conditions are caused by a single base pair among 3 million base pairs. This is essentially taking a technology that was NIPT, non-invasive prenatal test, and bringing it to its physical limit. For those of you who don't know us, I would say that we are much more than a company. We didn't even set out to do this as a company. We wanted to solve really big problems that weren't being solved otherwise. The vast, vast majority of our leadership is clinicians and scientists. And one thing that we don't do, we don't look at what other companies are doing and trying to replicate that. We ask where the gap is, and we build the technology to solve that gap. So from that perspective, supporting us is not just supporting what tests that we have today. It is supporting the innovation in prenatal testing. Because what we have today is truly amazing. What we have been able to accomplish really move the field forward, change medical guidelines. But it is also so small compared to what this can be. And by supporting us, you are supporting that innovation. You are supporting the only company that is moving this field forward. So if you look around you, you will see that we have filled the panels with history. They represent 60 years of advances in prenatal genetics. 1960s gave us prenatal ultrasound, 70s amniocentesis, 80s CVS. Each advance closed the gap, but it also made a new one possible. In 2000s, for the first time, we had prenatal chromosomal microarray. We could see more than just aneuploidies, higher resolution, but still invasive. I think most of you would agree that 2010s were particularly an acceleration of prenatal genetics. For the first time, from a simple blood draw, we could tell the chromosomal risk in a pregnancy. And NIPT genuinely transformed this field. And in 2019, we took our place in this journey. We brought NIPT from millions of base pairs to a single base pair resolution, launching for the first time an NIPT that can screen for important conditions like sickle cell disease, cystic fibrosis, SMA. And we are already seeing that it is changing not just the diagnostics paradigms, but even treatment paradigms, because that is what great diagnostics does. Great diagnostics changes not just the information that you are getting, but the next steps. But we didn't stop there. We launched the first non-invasive fetal antigen test. The work that underpins our collaboration, our partnership with J&J on hemolytic disease of fetus and newborn. We expanded that to essentially almost every antigen that is possible. It already changed medical guidelines. So what is next? A patient gets a high-risk prenatal screening result. Then what? For almost 50 years, the answer has been an invasive procedure, CVS, amniocentesis. Procedures that require specialist access most patients do not have, and the majority of high-risk patients ultimately decline. So they go home, they wait, they worry. They make some of the most important decisions of their lives with incomplete information. If you walk into our lab, we have a motto as you enter: remove the fear of the unknown for every patient. That is with that mindset, we set out to bridge this gap. We realized that this was not good enough. And NIPT is incredible, and we built the best non-invasive prenatal test that cell-free DNA allows us to do. We developed a technology that is down to a single molecule sensitivity with single base pair resolution, but it is still a screen. So now I am truly honored to be here to tell you about something, show you what we are launching today, bridging that gap. So with that,
nature cannot offer certainty, but in the earliest stages of life, when decisions carry profound implications, clarity matters. Prenatal screening has transformed care. From a simple maternal blood draw, we can assess risk earlier than ever before. Yet for patients who receive a high-risk result, a critical gap remains between screening and invasive diagnostic testing, a gap defined by uncertainty. At BillionToOne, we focus on what is possible, not just today's standard. In the past 6 years, we have redefined prenatal testing, introducing first-of-its-kind capabilities across recessive single-gene conditions, chromosomal conditions, and fetal antigen status through a single integrated platform, Unity. Now, we are going one step further, beyond cell-free DNA and fetal fragments to an intact circulating fetal cell. Introducing Unity Confirm. Unity Confirm isolates and sequences rare intact fetal cells from maternal blood, enabling direct assessment of fetal chromosomal status. This approach provides non-invasive confirmation of a high-risk aneuploidy screening result. Unity Confirm is designed to broaden access for patients who cannot or choose not to pursue invasive diagnostic testing. Confirm complements existing clinical workflows, including specialist referral and ultrasound, when options feel limited. This is not only a scientific advancement, it is a step forward in how we care for patients during a critical time in pregnancy, supporting providers in guiding informed decisions. Because behind every result is a patient, a family, and a set of choices that matter deeply. Unity Confirm, non-invasive confirmation of high-risk Unity aneuploidy screen results, powered by fetal cell capture technology. By BillionToOne. Unity, the new standard in prenatal care.
Yes, tonight we are proud to introduce Unity Confirm. Unity Confirm is the first non-invasive confirmatory test for high-risk aneuploidy results. We are capturing intact circulating fetal cells, isolated from a standard maternal blood draw, and we are doing whole genome sequencing on that intact fetal cell, one cell at a time. Unity Confirm is available to all patients who have received NIPT results through Unity Aneuploidy Screen. As is the case with every single product that we have ever launched, it is accessible to every Unity patient who needs it. You can order it immediately once a high-risk result comes in. So why is this hard? This has always been the holy grail of prenatal screening. We are standing here because of others. This has been a field that has been worked on for more than 20 years, even before the advent of cell-free DNA testing. Scientists and visionaries have dreamed about isolating fetal cells, and with the availability of whole genome sequencing, now you have an intact fetal cell, 100% fetal fraction, that you can sequence, pure material. But it was too difficult. The biology was unforgiving. In a tube of maternal blood, there are billions of cells and only a handful of fetal cells. So if you think about fetal fraction, this is not a few percent. This is less than 1 in a billion. You have millions of just even white blood cells, and you are trying to find those extremely rare fetal cells. This is truly art and science. It required 2 years of development and product engineering to make this reliable. We hyper-optimized every single step. We have built it on 2 decades of work that came before us. But even with these innovations, this is extremely labor-intensive work. The work that we are putting here is almost equivalent to IVF. Right? You are trying essentially to find this extremely rare cell that is circulating in maternal blood, capturing it, and then doing a whole genome sequencing on it. But the results are amazing. The real innovation here is really the ability to deliver this result to all patients who need it. The fundamental science had already been validated. There are multiple publications in academia that show that if you can capture a fetal cell, the results are, for the most part, indistinguishable from any invasive diagnostics. We have also directly seen the power of these results. We have real patients in the United States, and in our white paper, we had 16 patients representing all common aneuploidies, where we confirmed our results and we compared them to CVS and amnio And every single time, 16 out of 16, it was concordant. We are also now enrolling the largest prospective cell-based clinical trial with invasive diagnostics outcomes, with more than one patient being targeted for this study. So who is this for? I know that you can already think about a patient who would really benefit from this. Today, more than majority of patients in the United States, close to 70%, even with a high-risk result, they cannot get amniocentesis or they choose not to get amniocentesis. So this is for a patient who can't take time off from work for a procedure. This is for a patient who lives 3 hours from the nearest specialist or cannot access CVS in time. This is for the patient who is scared and not ready to make a decision about diagnostic testing without more information. So starting later this month, if you have a high-risk result through Unity, we will offer you Unity Confirm so that you can get your patient the information that they need. Our job here is to make sure that access to answers after a high-risk result does not depend on where you live or what your socioeconomic status is, that this is available to every patient, and this is a principle that we have never compromised on, and we are not going to compromise on it with Unity Confirm either. I want to be very clear about one thing. Amniocentesis remains the gold standard in diagnostic testing. We are not changing that here. What we are doing is that for the patients who cannot or choose not to access amniocentesis, that they have the information that they need to be able to make one of the most important medical decisions in their lives. There are so many people at BillionToOne who made this launch possible. When we first started this, the results were a complete failure. It was very difficult. It was very challenging. Our team doesn't give up because they realize that there is a patient behind every single test tube, every single sample that we receive. So they persevere, they worked relentlessly, solving one problem after another. They all went further than what was considered really reasonable. We are standing here because of them. So tonight I want to call out 3 people specifically. Hayin, who is our lead scientist on this product. She found a way to capture that 1 in a billion cell so that we can do this. Amy Sharma and her team, who shepherded Amy. Who shepherded Unity Confirm from a science problem to a clinical product. Again, it is easy to do sometimes the science. In this case, it wasn't that easy, but still. It is even more difficult to bring it to a clinic in a way that you can give access to every single patient who needs it. And that was, for Unity Confirm, Amy and her team. And Jen Hoskovich, who introduced me a few minutes ago. Jen and her team of MSLs are the ones who are going to walk thousands of clinicians and patients through what this means for them. They will be the face of our company. They have always been. And they are going to be the ones that make this possible in the field, along with our representatives. These people and many others are the team that have brought you the first fetal cell-based confirmation assay in the United States. They have really taken a challenge that has been seen as holy grail for more than 20 years, has been inaccessible, has been too difficult, and made it possible. So finally, I would like to refer back to our startup days. While I talk about those days all the time, it is also important to that we realize that we are no longer small. Because of your support, this is really because you supported us that we have been able to work on this and bring another innovation to prenatal screening. And it is fitting that just last month, we surpassed an incredible and humbling milestone of having helped over 1 million patients. Most of those patients will never know our name, but serving them, and all of them equally, is something that we are truly honored to do so. So now, please raise your glasses with me. To the patients that this would benefit, to the science that got us here, and to every clinician in this room who is going to help the patient access it. Thank you for your support, and we are really looking forward to continuing to transform prenatal screening and genetics. Thank you. Cheers.
Wow, thank you for all of you who have joined us through the live stream this evening. I'm Jen Hoskevec, VP of Medical Affairs at BillionToOne and a certified genetic counselor. You have just witnessed the launch of Unity Confirm, the first non-invasive confirmatory test for a high-risk NIPT for aneuploidy. As someone who has spent my career counseling patients through high-risk results and decision-making, I couldn't be more proud to be part of this launch and bring it to you this evening. So with that, we have some incredible people standing by to share with you at home their thoughts about tonight's product launch. So first, I'm going to have Dr. Ramu Purney. Hi there. So Dr. Purney is a maternal fetal medicine specialist and is our medical director here at BillionToOne on the prenatal side. So Dr. Purney, as a practicing MFM for over 20 years now, when you first heard what BillionToOne was doing with fetal cell capture, isolating intact fetal cells for whole genome sequencing, what was your reaction?
Wow, Jen. First, it was just pure excitement. I mean, not only was it exciting from the perspective of all the scientific marvels and all that it represents, but I was most excited about what we'd be able to do to help people, our patients, families, because there's so much of an unmet need when you get that high-risk result. So the first pure emotion was just excitement for all of the people that we can help, especially those that we can get to that really are looking for answers. And I think that's truly what the first feeling was.
Absolutely. I share that with you. And what would you like every OBGYN who's hearing this tonight to understand about Unity Confirm as a product? They may not have fully absorbed everything that we were sharing with them tonight, but what's important for them to take home with them so far?
No, that's a great question because that's why we're all here, right? But I guess my message and the big takeaway, I wouldn't want to just make it to obstetricians, but for anyone who's taking care of people in this space, whether it's our midwives, nurse practitioners, whoever you are, family physicians in certain places, anyone who sends first-line non-invasive prenatal testing or NIPT, I would strongly urge them to use Unity Aneuploidy Screen as their first-line test, because then they will have the ability to use everything that Ozan just went over to help in those situations where this testing would be really needed.
Thanks. And I think many of you probably have this question as you're watching, but anytime a new test enters the market, we all have the same fundamental question, which is, what does the data actually show? And Ozan shared a little bit about that, but what can you tell us about the clinical evidence behind Unity Confirm so far? And how are you thinking about continuing to build that evidence base over time for providers who are going to follow this story?
No, that's a great question, and I think Ozan hit on it, but this technology and how amazing it can be has been around for a while, but really more like in academic settings and in specialty labs, meaning that the technology and what he went over with Unity Confirm has been done after 1,500 other patients were published upon across the world. So in our white paper that's coming out, we chose to do that here in the United States. In our paper, 16 patients, as Ozan touched on, there was complete concordance, 100%, between the capture technology and what the outcome was with the diagnostic testing that was completed. So this is a great initial first start. We clearly are enrolling a much larger study of hopefully over 1,000 patients in a prospective manner to continue to build upon the work that we've already done. But again, the shout out is to people who've done it before, but we want to make it so we bring it accessible to everybody in the clinical market to get the full benefit from the science behind all of this. So.
And I agree with you. I think the accessibility is really key. And for those of you out there, stay tuned to hear more. Not just about the current data, but the data that we are continuing to generate and the opportunity perhaps to participate in the ongoing study. So thank you, Dr. Perney. Enjoy the rest of your evening.
Thank you.
Okay, next up, we have Amy Sharma. So Amy Sharma, as you heard Ozan announce, is our Senior Director of Product here at BillionToOne, and really the driver behind this Unity Confirm product. So thank you so much, Amy, and congratulations. This is a big night for you.
Very exciting.
So May 28th is the date that this becomes available to patients, and so that's not far away. So what does availability actually look like, and what should a provider do now if they want to ensure that their patients have access to this test once it launches towards the end of the month?
Yeah, it's really fun, and it's crazy that we're here, and it's exciting to get to think about this. So Unity Confirm will be part of the Unity aneuploidy test. So if a patient receives a high-risk result, then Unity Confirm will be made available to them. And so that will happen kind of automatically. You'll hear more about it closer to our go-live date, May 28th. And so in terms of what someone can do now, we talked a little bit about how delicate the science is, and really it's the earlier that we can capture these cells, the better. And something that I learned in speaking with clinicians is that they didn't realize that Unity aneuploidy could actually be ordered as early as 9 weeks. And so, for those of you who are using Unity aneuploidy already, you may want to think about, maybe it makes sense for me to get my patients in a little bit sooner at 9 weeks so that I could have more patients be eligible and get access to this testing. And for providers who aren't using Unity aneuploidy right now, we'd love to talk to you and tell you more about why Unity aneuploidy is an excellent aneuploidy screen and how Unity Confirm fits into that story.
Amazing, thank you. So, tell me a little bit about the process of building this particular product. You spent almost 2 years bringing this from concept to launch, and Ozan mentioned the challenges, particularly with the science that you guys experienced. So what surprised you most during that process, and where did you have to be most rigorous or disciplined in the development to ensure that it was done right?
Yeah, I love that question. So yeah, the science part of this was really tricky and really exciting. I really loved thinking about that side of it in partnership with Hyen, who is our lead R&D scientist. But what was really interesting was figuring out how to make this test accessible. Ozan talked a little bit about how it's really important, it's core to our story, that if we're building something, we want to make sure that everyone has equal access to get access to the testing. And so we had to figure out what that looked like. So spoke with nearly 30 clinicians, a lot of our medical advisors, and it really felt like we co-developed this product with our medical advisors to figure out how will this fit into practice, where does it fit in, and so I'm really happy with all the feedback we got from clinicians and the reception. It's been a blast talking about this, and it's really fun to be able to talk about this externally now. Yeah.
It is very exciting, and those of you who are listening in, I know you have a million questions, and we promise that you will be hearing from us very soon in a variety of ways to answer those questions for you. And finally for you, Amy, what does this innovation or product mean to you personally?
Yeah, it means a lot. I actually shared when we announced this to our company today, I hadn't shared this too frequently, but I actually unfortunately had to undergo a CVS, and I just remember that moment, that decision point, just wanting as much information as possible. And so just having that patient perspective was, I think, really a driving force in terms of how we thought about decisions that we were making about this product. And I'm really happy with the way it came out. In particular, we already talked a little bit about access and making sure all patients get access to this test, but also just that sense of empowerment. Information is power, and again, just kind of thinking back to that moment, having access to a testing like this, I'm just so proud of it, and it's a really exciting innovation. It's been fun to bring it to life.
And you should be proud. This is an incredible product, and I couldn't agree more. The opportunity to bring patients yet another option for them to consider to meet them where they are on their journey and decision making is just really, really a gift for us at BillionToOne to be able to bring to patients that we serve. So it couldn't have been done without you, and we're so happy that you were able to share this with us tonight. So thank you, Amy.
Thank you, Jen.
Okay. So we have our final guest with us tonight. This is Dr. Nguyen. This is Dr. Tin Nguyen. And Dr. Nguyen is a maternal fetal medicine division director at Nemours Children's Hospital in Florida. And he's joining us tonight as a clinician who's in the trenches. And so we appreciate you. Hi. We appreciate you taking that opportunity to speak with us. So, Dr. Nguyen, as an MFM, you spend a lot of time counseling families who are high risk for a variety of reasons, but counseling them through this decision making at a time that's quite stressful for them, right? And so, how would having an additional data point like a result from Unity Confirm change maybe that counseling for you and your patients? How would you incorporate this?
So, I think, the way to incorporate it is it gives a patient another choice. So, not every patient is interested in doing invasive testing because, so many of them have invested so much emotional and financial energy into the pregnancy, and they don't want to do any test that poses any kind of risk to the pregnancy whatsoever. So I think that's really where its biggest selling point will be, and its clinical utility is going to be those patients who want confirmation that doesn't threaten the pregnancy in any way. So I think that's how it will help.
Yeah, I agree. And when you heard about Unity Confirm tonight, kind of listening to Ozan's presentation, what was your first thought?
I was just wildly impressed because I thought that was always kind of talked about sort of the holy grail, something that could not be done. And so the fact they were able to accomplish it on a production commercial level is really quite impressive.
I know it's something that I've been following my entire career, and honestly, when I realized it was actually going to be available to patients, it's kind of surreal, isn't it? Yeah. So in thinking, and you kind of alluded to this a little bit, but when you were listening to this, were there certain patients or patient types that you immediately thought, man, they would have really benefited from this option or this opportunity?
Yeah, I did. So the first patients I thought of are sort of those ones I mentioned before, those IVF patients, but also those patients who've had many pregnancy losses, and they're going through this process, and they really don't want to incur any excess risk. So they don't want to take any chances with the pregnancy, even if it means there's going to be something abnormal about the baby. They want to take no chances. So I think that's who it's for.
Yeah. And just to kind of cap it off, what is, as a maternal fetal medicine specialist, I know you are looked to by many of the OBGYNs and mid-levels who refer their patients. So what would you want them to know about this particular new product as it nears the actual launch date of May 28th?
Yeah. So I think the most important thing you can see is what we've always talked about is early care and early testing will give you the patient the most options in terms of what to do. Because, with these tests, and no matter what it is, if you don't do them early enough, there's really not much you can do about them. So I think that's where it will help. That's what I would say is that get your patients in early, get them seen, offer them testing early, and that gives them the best chance of a successful test.
Absolutely. I mean, information is power, right? And the earlier we can have these conversations, the more opportunity they have. Well, thank you so much for joining. We appreciate your time and enjoy the evening. So that's what we have for you tonight, folks. I'm so glad that you were able to join us for tonight's launch from home. As I said, stay tuned. We will have webinars. We will have opportunities for local dinner educational programs for you. We are always available to answer any questions that you may have. But we hope that you enjoyed this evening's presentations, the interviews, and got to learn a little bit about what we're doing here at BillionToOne. So I'm Jennifer Hoskevec, Vice President of Medical Affairs here at BTO. Thank you for being a part of this night, and have a wonderful weekend.